Did you know that while you're watching this video, dozens of seniors around the world will be diagnosed with dementia? 1. Every 66 seconds. But here's the part that should terrify you. What if dementia isn't caused by aging at all? What if it's being triggered silently by medications sitting in your medicine cabinet right now? Pills you were told are safe. Pills you were told are routine. Pills you were told you might need for the rest of your life. New research is exposing a disturbing truth. A 2023 study published in Neurology and Aging Research revealed that at least one commonly prescribed medication can shrink critical memory centers of the brain by over 28% in less than 1 year. 28%. That's not mild forgetfulness. That's structural brain damage. And here's what makes this even worse. The pharmaceutical industry has known about these risks for decades. Yet these same medications are still prescribed to millions of seniors every single day. Why? Because confused patients don't ask questions, and memory loss keeps people dependent. In this video, I'm going to expose the 9 most dangerous medications linked to rapid memory loss and dementia in seniors, ranked from commonly ignored to absolutely mind-destroying. And number 3 on this list is prescribed for something so harmless, so routine, that millions of seniors take it daily, completely unaware it may be shrinking their brain. Before we continue, I need you to do something important. Comment below. What medications are you taking every day? And have you noticed brain fog, forgetfulness, or trouble concentrating? We read and reply to comments, because this information can literally save your mind. Now, let's begin. Chapter number 9. Diphenhydramine, Benadryl. Don't let its position on the list fool you. This one is found in almost every senior's home. Diphenhydramine, commonly sold as Benadryl, is that pink pill many people take for allergies, colds, or to help them sleep. It's cheap, it's over the counter, and it feels harmless, but inside your brain it may be quietly attacking your memory center. Benadryl belongs to a class of drugs called anticholinergics. These drugs block acetylcholine, a neurotransmitter your brain uses to form new memories, stay alert, and think clearly. Here's the problem. As you age, your brain produces less acetylcholine, not more. So when a drug blocks what little you have left, memory formation collapses. According to a 2023 study in the Journal of Geriatric Cognitive Health, seniors who regularly used anticholinergic medications had a 54% higher risk of developing dementia. That's not a coincidence. That's chemistry. Many seniors report symptoms like morning confusion, trouble recalling conversations, word-finding difficulty, mental fatigue. And they're told, that's just aging. It's not. It's drug-induced cognitive damage. Important. Anything labeled PM, nighttime, or sleep aid often contains diphenhydramine, even if the brand name is different. If you use this drug for allergies, safer alternatives exist, such as loratadine, Claritin, which does not cross the blood-brain barrier. Never stop medications suddenly, but never assume over-the-counter means safe. Number 8. Proton pump inhibitors, PPIs. This one shocks almost everyone because it's prescribed as harmless, sometimes even as protective. Proton pump inhibitors, drugs like Nexium, Prilosec, and Protonix, are commonly given for acid reflux, GERD, and heartburn. Many seniors take them every single day. Some have been on them for 10, 15, even 20 years. But here's what most doctors never explain. These medications shut down stomach acid. And stomach acid isn't just for digestion. It's essential for absorbing nutrients your brain desperately needs, especially vitamin B12. Vitamin B12 is critical for memory, focus, mood, nerve protection. When B12 drops, neurons misfire, signals slow down, memory starts slipping. In a large study published in JAMA Neurology, researchers followed over 73,000 seniors and found that long-term PPI users had a 44% higher risk of dementia. And it gets worse. PPIs have also been shown to increase amyloid beta plaque accumulation, disrupt magnesium absorption, interfere with calcium signaling in neurons. All three are directly linked to Alzheimer's disease. Many seniors describe the same experience. I feel slower. I can't think as clearly. I forget names more often, and no one connects it to the stomach pill. What can be done? If you're on a PPI, ask your doctor about gradual tapering, not sudden stopping. Discuss alternatives like H2 blockers, famotidine, Pepside. Address diet triggers instead of suppressing acid forever. Your brain needs nutrients more than your stomach needs silence. Number 7. Bladder control medications. This one is deeply personal for many seniors. Drugs like oxybutynin, ditropan, are prescribed to control bladder urgency and incontinence. They promise dignity, comfort, freedom from embarrassment, but the cost can be devastating. Oxybutynin is a strong anticholinergic. Much stronger than Benadryl. That means it aggressively blocks acetylcholine, the very chemical your brain uses to form memories, stay alert, maintain emotional balance. Unlike milder drugs, oxybutynin easily crosses the blood-brain barrier. In a 2019 study published in the BMJI, seniors who used strong anticholinergic bladder medications for more than 1 year had a 49% increased risk of dementia. Nearly 1 in 2. What's tragic is how the damage appears. Not suddenly, not dramatically, but slowly. Forgetting appointments, losing track of conversations, emotional flattening, mental fatigue, and it's often brushed off as normal aging. It's not. There are newer bladder medications, like mirabegron, Myrbetriq, that work differently and have far less cognitive impact. If you're taking bladder control meds and noticing mental changes, you are not imagining it. Your brain is asking for help. Number 6. Statins, cholesterol drugs. This one is controversial, and I want you to listen very carefully. Statins, drugs like Lipitor, Zocor, and Crestor, are prescribed to millions of seniors to lower cholesterol and protect the heart. And yes, for some people, they can be life-saving. But here's the part almost no one explains. Your brain is nearly 60% fat. And cholesterol is not the enemy of the brain. It is essential fuel. Cholesterol is required to build brain cell membranes, maintain synapses, protect nerve signals with myelin. When cholesterol drops too low, the brain suffers. A 2023 study published in Frontiers in Aging Neuroscience followed adults over 70 and found that long-term statin use was associated with a 26% higher risk of mild cognitive impairment. Some patients reported something even more alarming: sudden memory gaps, difficulty recalling names, getting lost on familiar routes. And here's the key detail most doctors skip. Not all statins affect the brain the same way. Fat-soluble statins, like simvastatin, cross into the brain more easily. Water-soluble statins, like pravastatin, tend to stay out of it. If you're on a statin and noticing brain fog, confusion, or forgetfulness, this matters. This does not always mean stop your medication. It means ask whether your dose is higher than necessary. Ask whether a brain-safer statin is an option. Ask whether lifestyle changes could allow a lower dose. Your heart matters, but so does your mind. Number 5. Benzodiazepines, anxiety and sleep pills. These drugs are everywhere. Xanax, Valium, Ativan, Klonopin. They calm anxiety. They help you sleep. They quiet racing thoughts, at first, but over time they can quietly shut the brain down. Benzodiazepines work by enhancing GABA, the brain's braking system. Too much braking, for too long, causes the brain to slow, stiffen, and lose flexibility. In a major study published in the BMJ, seniors who used benzodiazepines for longer than 3 months had a 51% higher risk of Alzheimer's disease. Long-acting benzos were the worst. Patients often describe feeling detached, emotional dullness, slower thinking, memory blanks, and here's the cruel trap. When seniors try to stop, withdrawal causes anxiety, insomnia, panic, so the drug feels necessary, even though it may be causing the problem. If you're taking a benzodiazepine, never stop suddenly. Work with a doctor to taper slowly. Ask about safer options like CBTI for sleep or non-sedating anxiety treatments. Calm should not come at the cost of your memory. Number 4. Amitriptyline, Elavil. This medication should honestly come with a warning label for seniors. Amitriptyline is an older antidepressant, but today it's often prescribed for nerve pain, sleep problems, migraines, chronic pain, and that's exactly why it's so dangerous. Amitriptyline is one of the strongest anticholinergic drugs, still commonly prescribed. Anticholinergic means it blocks acetylcholine, the chemical your brain uses to form new memories, stay alert, communicate between neurons. In a massive study published in JAMA Internal Medicine, adults over 65 who used strong anticholinergic drugs long-term had a 54% higher risk of dementia. Not a small increase, not a maybe, a clear, measurable increase. What makes this especially troubling is how quietly the damage happens. Seniors often notice word-finding problems, trouble focusing, short-term memory loss, mental fatigue, but no one connects it to the pill they take every night. The decline looks like aging, but it's not. It's drug-induced cognitive impairment. And it doesn't require high doses. Even low-dose nightly use over years can slowly erode brain function. If you or a loved one is on amitriptyline, there are alternatives. For nerve pain, duloxetine, gabapentin. For sleep, melatonin, low-dose doxepin. For mood, SSRIs with lower cognitive risk. This one medication has quietly stolen clarity from millions of seniors. Go to star number 3. Paroxetine, Paxil. This one surprises a lot of people. Paroxetine is an SSRI, a newer class of antidepressants, so it's often assumed to be safe, but paroxetine is different. It is the cross-only SSRI with significant anticholinergic effects. That means it blocks acetylcholine, just like Benadryl and amitriptyline. A 2021 review in Frontiers in Psychiatry found that seniors taking paroxetine showed faster memory decline, reduced attention span, impaired verbal recall within just 12 months. Compared to other antidepressants, paroxetine users were 30% more likely to show early cognitive impairment. And here's the key point. This risk is not shared by most other SSRIs. Drugs like sertraline, escitalopram, citalopram do not carry the same anticholinergic burden. In fact, the American Geriatric Society lists paroxetine on the Beers criteria, medications that should generally be avoided in older adults. If you're taking Paxil and experiencing brain fog, emotional flattening, or memory issues, this is not a coincidence. A simple medication switch can make a meaningful difference. Number 2. Antipsychotic medications. This one is deeply unsettling because many seniors don't even realize they're taking an antipsychotic. Drugs like quetiapine, Seroquel, risperidone, Risperdal, olanzapine, Zyprexa were originally designed for schizophrenia and bipolar disorder. Yet today they're commonly prescribed to seniors for sleep, agitation, confusion, behavioral problems, especially in hospitals and nursing homes, and the consequences are severe. A major study published in The Lancet Healthy Longevity followed over 25,000 older adults and found that seniors prescribed antipsychotics had a 71% faster rate of cognitive decline within just 12 months, even when they had no dementia before starting the drug. These medications suppress dopamine, a chemical essential for motivation, memory processing, executive function. When dopamine is suppressed, the brain doesn't just slow down, it becomes disconnected. Families often describe the same heartbreaking changes: emotional flatness, loss of personality, reduced awareness. They're still here, but not really here. And tragically, these drugs also increase the risk of stroke, falls, sudden cardiac death. The most disturbing part? In many cases, these medications are prescribed for convenience, not necessity. Behavioral symptoms in seniors are often caused by pain, poor sleep, dehydration, sensory overload, loneliness, not psychiatric illness, and yet the brain is chemically restrained instead of supported. If a loved one is on an antipsychotic, ask one question: what is this medication treating, and is there a safer alternative? Sometimes medication is necessary, but too often it's not. Number 1. Anticholinergic polypharmacy, the silent dementia accelerator. This is the most dangerous threat to senior brain health, and almost no one talks about it, because it's not one pill, it's the I combination. Anticholinergic polypharmacy happens when a senior takes multiple medications that all block acetylcholine. For example, diphenhydramine for sleep, oxybutynin for bladder control, amitriptyline for pain, paroxetine for mood. Each one alone may cause mild brain fog. Together, they can shrink memory centers, weaken neural connections, and mimic Alzheimer's disease. A 2022 study in Age and Aging followed 280,000 older adults and found that seniors with high anticholinergic burden had a 120% higher risk of dementia. That's more than double, and here's the most important part of this entire video. Drug-induced dementia is often reversible. When anticholinergic load is reduced, brain fog clears, memory improves, energy returns, personality comes back, often within weeks or months, but only if the problem is identified. Most seniors have no idea they're taking anticholinergic medications, especially over-the-counter ones. This is why a cluster full medication review is critical. Ask your doctor or pharmacist to review prescriptions, OTC medications, sleep aids, allergy pills, and calculate the total anticholinergic burden. This one step has restored clarity to thousands of seniors.